Good morning, Yade. As Sally said, I am a member of the Navajo Nation. I am also the operations director at Native Public Media. Um, I currently, originally from Tuba City, Arizona. It's, as you may know, Navajo Nation is one of the largest tribal nation in the country. Our land covers 3 states. We're pretty much the size of West Virginia. And one of the things that we're doing at Native Public Media, but I prefer, before telling you that, I just want to give you a little information about who we are. Native Public Media, we're a nonprofit organization, and our mission is to promote the self-determination of Indigenous peoples through media access, storytelling, and ownership. And we elevate local media efforts of our tribal broadcast station. In our network, there are 59 tribal broadcast stations. 56 of them are radio stations, and then we have 3 television stations. And in remote, rural tribal communities, tribal lands across the country, radio is essential. Radio is often the most reliable way or the only way tribal people or tribal citizens of that community receive information. And during the pandemic, it was one way to bring awareness about the coronavirus in terms of how to protect yourself, being able to provide announcements about the tribal directives that were coming down per those tribal communities. In addition to that, just other types of emergency events too. And in the Navajo Nation specifically, there were, we were very hard hit. And a lot of that had to do with not having running water. A lot of our homes don't have the running water. And so when we were telling people to hand wash, because water had to be hauled to those remote communities, that was really hard to do. And so that was one of the huge challenges in Navajo Nation specifically, and other tribal communities as well. And what we did with Native Public Media is we wanted to help address that by using our airwaves to reach tribal communities about protecting themselves. Radio is really cheap, in addition to that, our tribal communities don't have broadband. And so there's not that access for them to have even secondary services, electricity, running water. And as Robin had pointed out, the transportation to go to a grocery store, having to drive a couple of hours to go get groceries, or even to receive medical care. So those are some of the challenges that I think that really help, or that didn't help, but caused the coronavirus to really spread across our communities. And we are a community, we are a family. That's how we consider ourselves. We're not necessarily related by blood, but we have a clanship. And so our community is our family. We don't look at it as just a nuclear family, but our extended families are, my nephew and nieces are my sons, my daughters. That's how I recognize them. They're not my nieces and nephews. So those are some of the things that we looked at as we went through the pandemic with Native Public Media. Is how do we want to provide awareness and really avoid misinformation presented to our communities, but being able to provide some accurate and relevant information to our tribal communities and that ultimately reach the people that were living in those communities. Yes, thank you again. So Native Public Media, on the onset of the pandemic, really wanted to make sure that we provide accurate information to tribal communities, and knowing that we had tribal radio stations across Indian country, we took advantage of that. And we created a program called the Broadcast Service Program. And the Broadcast Service Program provides critical revenue from our funders or from different stakeholders, community service organizations, or they support to provide quick deployment of emergency communication using public service announcements. In this case, it was a COVID public awareness, and then just this year, it was centered around vaccinations. So we serve as a one-stop shop for underwriters to buy airtime on our network. We work with the radio station to provide scripting and help produce public service announcement. And we create a campaign package and give that to our radio stations. And some of that really included creating taglines. Early on, we created the vaccination tagline, and we used that in our public service announcement. And the idea was to get our tribal communities to get vaccinated. And we knew that there would be an initial hesitancy once the vaccines rolled out. And some of you alluded to this, was the knowing that in tribal communities, the hesitancy really is around trusting the federal government. And a lot of this stemmed from just history of mistreatment in the healthcare for many Indigenous people. This could include, doing unethical research practices, or just different wronging in terms of the public health. So we looked at how do we want to create public service announcements for our partners that wanted to use our airwaves. And so we looked at also just what do they want to protect. It wasn't about me, it wasn't about them, but it was more at a community level. We really focused on wanting to protect the elders initially when we started this campaign in 2020. Our elders in tribal communities they hold our language, they hold our culture, they hold our tradition. And to protect that was one of the messagings that we had, is we wanted to make sure that our community, the younger generation who respect our elders and look up to our elders, is we want to make sure that our language continue, and that our tradition and our cultures, that they continue as well. And so we talked about that as protecting that community, protecting our elders, because they hold so much. And some of the other vaccination campaigns that we've also developed and working with partners also centered around getting vaccinated when it is your time. With the rollout of the vaccine was really the population, elders first, and it went down from there. And so we continue to do public service announcements about when it's your time. But in the meantime, continue to wear masks, continue to social distance, continue to practice all these safety protocols. And we found that it definitely was helpful to getting the messaging out there using our airwaves in the 56 radio stations that we have. And out of the 574 tribal nations across Indian country, we just did a report where we tracked from January to September 15, 2020, using the data that came from the CDC. Is January 1st to September 15th, we've had more than 1.4 million Native American Alaska Natives vaccinated. And then also half of those people were also at least had one dose of vaccine. So our messaging really just stems from what is most effective. Protecting family, protecting our culture. It's not about me as an individual, but more about the community, because we want to protect our elders, we want to protect our parents, our community, our language, our culture. In addition to that, also using what currently right now, we're working with another nonprofit to develop a vaccination campaign. And they're using someone who's highly trusted, or someone that Indigenous peoples could relate to. This organization is using, if you're familiar with the show Res Dogs on FX, the spirit character in that show is played by Dallas Goldtooth. And they felt like this person was definitely credible, but people could relate to it, because Res Dogs was, if you've seen it on social media, a lot of Native people watch that show. So they're using that as someone who's is an influencer to help encourage those who are unvaccinated to get vaccinated. In addition to that, I think just using people who look like you. As a Navajo, I always appreciated having someone that looks like me talk to me. So using Native American health professional doctors or nurses to talk to the indigenous community to encourage people to protect their communities. Also found that tribal leaders are also trustworthy by their own community members as well, to help increase that vaccination rate. And then for those unvaccinated people is really just to make sure that, you know, they're talking to their friends or families, that they want to protect them, helping them and encouraging them to get vaccinated. And in closing, we have been doing campaigns for different foundation organizations. We're finishing up our 4th campaign, which is focused on holidays. And this grant that we received from the Corporation for Public Broadcasting helped us do that. And we're working with 36 tribal radio stations across Indian country. And we're also tracking the vaccination rate, and just want to share some of the vaccination rates that since September 15th. For example, the highest vaccination rate is a station that we work with is KIYU, and they had a vaccination rate of 82%. The Southern Ute Tribe, the radio station there is KSUT, and they had a 75% vaccination rate. Navajo Nation, we have several commercial and non-commercial stations in Navajo Nation, and Navajo Nation right now has a 72% vaccination rate. The KCIE, the Jicarilla Apache tribe, has an 80% vaccination rate. So really feel like using the local radio stations, in our case, the tribal radio station in our community, really to be able to air these public service announcements and tailoring it to what the messaging that works well, is really protecting and making sure that they're protecting their community.